Lung sounds are classified into two categories, normal and adventitious. Normal lung sounds are generated by airflow in the respiratory tract. It is further divided into three types: vesicular, bronchial and bronchovesicular. Adventitious lung sounds are abnormal sounds resulting from unusual airflow through lungs. They are musical in quality and usually last more than 250 milliseconds. Vesicular sound are breezy sound, soft and low pitch in nature. They have longer duration of inspiratory phase. The I/E ratio is 4:1. The name is misnomer as they are not produced in alveoli, and are present over most of the chest. Bronchial sounds are loud, high-pitched. The expiratory phase is longer than inspiratory phase, with presence of gap in between both the phases. They are distributed over the laryngeal and tracheal region. Bronchovesicular sounds, as the name suggests, are intermediate in character between bronchial and vesicular sound. They are heard at the first and second intercostal space and in between the scapula. Wheeze is a whistle-like sound, high-pitched in nature. It is heard due to passage of air through narrowed lumen. Wheeze can be heard in chronic obstructive pulmonary disease, asthma and lung cancer. Asthma has polyphonic type of wheeze, heard mainly in expiratory phase. Whereas lung cancer has monophasic wheeze which can be heard in both inspiratory and expiratory phases. Rhonchia continuous, low-pitched sound and sonorous in nature. Crackles, also known as rales or crepitations. They discontinuous adventitious sound, non-musical in nature. They are further divided into fine and coarse crackles. Pleural rub is a harsh, non-musical, discontinuous adventitious lung sound. It is heard as superficial grating sound, produced due to rubbing of pleura against each other. Some causes of pleural rub are pleuritis and extreme pneumonia.